There's so much misinformation out there on lip fillers and other lip augmentation procedures. Are lip fillers permanent? Are lip fillers dangerous? Will too much sun exposure break down lip fillers? And are lip lifts better than lip fillers? Let's bust some myths. Lip fillers are permanent and cannot be reversed. Fiction. Of course, it depends on the filler. Injectable silicone and other fillers like PMMA are either permanent or semi-permanent and cannot be dissolved. And the only way to address these later is to actually cut out a portion of the lip mucosa where that filler has gone to remove it from that area. HA fillers, on the other hand, are not permanent and they can be chemically dissolved with hyaluronidase. However, HA fillers last longer in the body than most manufacturers and providers want you to believe. But some of the effects of HA fillers can be permanent, such as the stretching out of lips after repeated injections over many years. And they may never return back to their original size even after dissolving. Lip fillers always look fake and obvious. Fiction. Lip fillers can be performed elegantly. Usually it's better to inject smaller amounts over time rather than doing too much at any one time. I'm not a fan of injecting at the vermilion border because that is what often leads to that duck-like appearance that most people dread. I'm also not a fan of injecting into the philtral columns because while the intention is good in that people are trying to recreate the philtral columns, oftentimes it looks quite unnatural because what makes the philtral columns effective in youth is that the central area between the philtral columns is more concave, and so when you're injecting filler to recreate the philtral columns, if the central area is more flat, you're not really getting the same effect, so it doesn't look natural. I also don't like putting filler into the upper cutaneous rhytids or those wrinkles that some people get. I think for those wrinkles, it's much better to do laser resurfacing or deep chemical peels to improve the area. And also the migration of the filler from the philtral columns and from the upper cutaneous lip in general can lead to an unnatural type of look. It can take a few weeks to see the results of lip filler. Fact: the lip filler results that you see online are those immediate results, which is not exactly how it looks after a few weeks of having the filler in your lips. It takes time for the swelling and any bruising that you get to settle. Some patients will actually come back after 1 to 2 weeks of the initial injection for a small touch-up. It is possible to customize your lip augmentation procedure based on your desired results. Fact: every person starts with different underlying anatomy and a different set of goals. Some want subtle and very natural, while other patients want a more exaggerated type of appearance. Some want temporary solutions with filler and Botox, while others are choosing more permanent options, such as lip lifts and/or implants. Men look bad with lip enhancement. Fiction. One must be really careful with lip filler for men, but it can be a nice solution for the right candidate. You need to be careful not to feminize the face with lip filler in men. The most common scenario is a thinner upper lip, where the goal is for an overall improvement in the size of the upper lip without creating too pouty of a look. A lip lift is a feminizing procedure and must be carried out with great caution in men, especially since the arching of the upper lip will increase. Your lips cannot become chapped with filler. Fiction. Some clinics will advertise lip filler to help with chapped lips, but filler is used to hydrate on the inside of the lip, not on the surface. Injections or surgery that expose more of the red mucosal lip, essentially taking it from the wet area and rolling it out and making it more of a dry red lip, can lead to more chapped lips. So that's something that filler can actually promote. So if you put filler into the lips and now you're causing the lips to get bigger and they're actually rolling out, some of that tissue that's used to seeing a wet environment is now seeing a dry environment and can lead to more chapping. If I get lip fillers, I will constantly need to refill them. Sort of. Again, it depends on the type of lip filler that's used. Assuming an HA filler was used, the effects of that filler will start to subside after 3 to 9 months on average. At that point, one must decide if it's time to refill those lips to return to the desired look, or to actually add volume, or to let the lips go back to a more natural state, or even get the filler dissolved if needed. If you're enjoying this video, make sure to subscribe and turn notifications on. Swelling and bruising are common after lip injections. Fact: swelling is guaranteed after lip injections and really after any lip augmentation procedure. For fillers, it usually takes about 3 to 12 days for the swelling to subside. Bruising doesn't always happen, but it's very common. Remember, a bruise is not an indication that the procedure was poorly performed. You can get bruised with one procedure and then not get bruised the next time around with that same provider. There are many blood vessels in the face, and one cannot see all of these vessels when injecting filler. This is also one of the reasons that lip filler can be dangerous from a vascular occlusion perspective. Only people with thin lips can get lip enhancement. Fiction: people with all types of lips present for enhancement. It's not always about the size. Sometimes it's about improving symmetry or the contour of the lips. And some patients with fuller lips still want a lip lift surgery in order to reduce their philtral distance and improve their overall facial proportions. But that must be done carefully, not to make the upper lip too large relative to the lower lip. Augmented lips will feel no different compared to natural lips. Well, it depends. Most of the time, once the initial swelling settles down, people report that their lips feel normal. However, certain types of lip augmentation, such as solid silicone implants, can change the way that the lips feel when they're in contact with other things. I stay away from using any type of silicone in the lips. Too much sun exposure will degrade the hyaluronic acid in my fillers. The answer is not so clear. Some clinics say that UV rays can degrade hyaluronic acid. One study in mice looked at the effect of repetitive UVB irradiation on dermal hyaluronic acid, not injected HA filler. They found that UV rays did cause loss of hyaluronic acid from the dermis. But a more recent in vitro study looking at HA produced naturally by bacteria showed that the HA served as a protective effect to human dermal keratinocytes against UVB damage. But we still don't know how exactly it works in humans. Regardless, sun exposure can be harmful to your lips and to your skin, so avoiding UV rays is generally good practice. Lip fillers can cause scars and cold sores. Fact: not all scars are on the skin surface. Repeated injections with HA filler can cause scar tissue to form deeper underneath the lip skin surface. This can cause a hardening of the area over time and potentially a more permanent fullness with repeated injections. Cold sores can occur with any type of trauma to the lip area, be it lip injections or some type of lip augmentation surgery. If you're prone to cold sores, let your provider know before you go in for lip augmentation so that they can prescribe Valtrex or a different antiviral medication to help prevent or to treat cold sores. Lip filler is a dangerous procedure. Depends. Lip filler is an overall safe procedure if performed by a licensed, qualified, and experienced provider. But there are rare catastrophic complications that can occur, such as vascular occlusion, leading to skin death, blindness, and potentially even a stroke. Also, infections and allergic reactions can occur. While the highest risk areas for injections are considered to be the forehead, the glabella, and the nose, the lips are still considered moderate risk for complications. This is why these procedures need to be taken seriously. And make sure that your provider knows what to do in case of an emergency. There needs to be a plan in place. And because of these potential risks, I sometimes feel more comfortable performing lip lift surgery, where many of these complications are not really on the table, compared to filler, where you just never know when you'll get one of these rare complications. Are lip lifts better than lip fillers? It depends. It depends on the person's goals, their underlying anatomy, and their surgical candidacy. For a person with a short philtrum, good upper tooth show, and an arched upper lip who's looking for volume, filler is a reasonable option. For a person with a long philtrum, a thin, flat upper lip, and no upper tooth show, a lip lift may make more sense. Lip filler is not a way to try out a lip lift result. The two lead to very different aesthetic outcomes, similar to nasal filler compared to nasal surgery. Talk to your provider about what might be best for you, and to check out some lip lift results, head to cityfacialplastics.com. Make sure to check out this other video on lip augmentation procedures.